Hi, folks. My Democratic colleagues and I have been trying for the last several weeks to explain what this Republican healthcare crisis is going to mean to millions of people all over this country. Real stories from real people's lives. And I'm so glad that right here in Marin County, in the heart of my congressional district, I have one of those people to share their story with us. Sophia here is going to tell us a little bit about the healthcare stresses and challenges that she is facing and what some of these cuts would mean to her and her family.
So I am part of the sandwich generation of taking care of my aging parents as well as taking care of a young child and myself as a single mom and only child. It's a lot, and received the notice that the tax credits for my covered California plan is subject to go away, which means that my $180 monthly payment is gonna could go up to $600 or more a month.
Yeah.
And on top of that, my dad is currently in the hospital awaiting a heart transplant, and I'm worried about what Medicare will cover on his care now and when he eventually gets that heart transplant, and awaiting what happens between now and then, how I'm going to take care of him and take care of myself and take care of my daughter through this, and just everything getting more expensive and income not
Yeah.
going anywhere else.
What do you do, Sophia?
I work for a funeral home provider, but
Okay.
have recently received a layoff notice.
Okay.
So that is going away, and don't
And
know
you
where I'm going to make ends meet.
and you've had this coverage through the Affordable Care Act for the last several years?
Yes, I was self employed during the pandemic, and it was an affordable option for me then,
Right.
and was a better option than what my employer was providing. And
Yeah.
then here we are.
This is the story of so many people who for the first time found affordable coverage, especially self-employed folks, entrepreneurs, small businesses. That's sort of the niche where this premium tax credit has made healthcare finally affordable. And that was the case for you, huh?
Yeah, I have always liked working for small businesses and and then I eventually worked for myself, and then saw an opportunity where I could help people in the community. Though it was through a corporate company, I saw the benefit that I was still helping my local community, but the corporate company decided to close our local office, and now I'm trying to find other ways to help myself and still serve the community somewhere in some
Right.
way.
So $180 a month is a pretty reasonable healthcare premium, but to see that just almost overnight triple, more than triple in your case, is going to force some terrible choices, huh?
That is, yeah, $600 a month is a lot.
Yeah. And what a lot of people do when they're faced with the choice of can I afford health care or can I afford taking care of my father and feeding my family and paying my rent, they choose to not get health insurance. And that puts them into all kinds of other terrible scenarios if someone gets sick, if something goes wrong. And that's really kind of what we're talking, that's what you worry about, huh?
That is definitely what I worry about. Of, do I spend the money to take care to get the scans I need? I have I am a brain aneurysm survivor. I need to make sure that I am healthy because I'm a single mother. There's no one else to take care of my
Yeah.
daughter. So I need to keep myself healthy. My dad has no one else but me. He's divorced, and I'm an only child. If I'm not healthy enough to take care of him, who will?
So this sounds really abstract. It's a premium tax credit under the Affordable Care Act, but this is what it is in real life, in the real world. That's why we are fighting this fight, and that's why we're trying to end the cuts and save healthcare from this completely unnecessary crisis that Republicans are forcing on us. Thank you for sharing your story, Sophia.
Thank you for hearing me.